simple. So this is level 6 evidence, but do a fair amount of ankles, and with that, obviously, more wounds to deal with. And I mean, we're super sensitive, I feel like, in my clinic to wounds. I have a nurse that works with me that I hired out of the wound clinic at our hospital who used to run the wound clinic. My wife is on our team now as a nurse practitioner. She used to work at the wound clinic as well. So, I mean, it's amazing. Like, you feel like a bad orthopedist. Like, they will call things wounds that I would just be like, looks great. That scab's going to fall off in about 3 weeks and you'll be good. So, especially with total ankles, I was trying to find ways to, they look good at 2 weeks, or, you start to put them in a boot and they rub. So I started to mess around with an external brace called the Taco brace. And so I started putting people from a shoe. If it wasn't a lot of footwork, I would put them in a shoe right out of the cast with this brace goes on the outside of their shoe, so they don't have to deal with being uneven in a cam boot, and then they don't get the rubbing on the anterior wound. But even with that, I just feel like it wasn't enough, and I don't do that on everybody, but these are some things I did that I felt like cut down my wound rate by about 30 to 40%. I started doing TXA, 2 doses. I feel like, most people think about it for the bleeding, but I actually noticed the first couple I did, the wounds looked much better, and that was really the only variable I changed. I don't use retractors, self-retaining retractors, I should have wrote on there. So if I see the fellow grab a Gelpy, I throw it on the floor, so I can't use it. I see way too many pictures of people having Gelpies in, and it's a killer, not just for the skin, but it sits on the bundle.